is Kasima and I am doing Ethiopia. So Ethiopia is a country located in the Horn of Africa. It has a population of about 117 million people. The country has made significant progress in improving health outcomes in recent years, but still faces a number of public health challenges. The life expectancy is 66 years old, which is below the global average of 72. The gross national income per capita is about $900, which is one of the lowest in the world. And poverty is also a significant issue in Ethiopia, with an estimated 23.5% living in poverty. Ethiopia is ranked 175 out of 189 countries in terms of human development. This puts Ethiopia in the low human development category. In comparison to its neighbors, Ethiopia ranks higher than Sudan and Somalia, but lower than Kenya. Overall, Ethiopia's low ranking in human development highlights the need for continued efforts in order to improve the health and well-being of its people. So Ethiopia is a federal parliamentary republic. The country has long and complex history, with multiple kingdoms and empires throughout the centuries. More recently, Ethiopia has been marked by political instability and conflict. The country has a federal system of government with 10 regional states and 2 administrative cities. Ethiopia has a long history of political instability and conflict, including a civil war that lasted from 1974 to 1991. The burden of disease in Ethiopia is dominated by communicable diseases and maternal and child health issues. According to the World Health Organization, the leading cause of mortality in Ethiopia are lower respiratory infections, neonatal disorders, diarrheal disease, HIV/AIDS, and tuberculosis. In addition, maternal mortality remains high, with an estimated 401 maternal deaths per 100,000 live births. The country has made significant strides in reducing maternal and child mortality rates over the past 2 decades, but there is still so much work to be done. Ethiopia is one of the highest maternal mortality rates in the world, and reducing maternal child mortality rates in Ethiopia is critical for achieving several of the United States Sustainable Development Goals, especially SDG 3, which aims to ensure healthy lives and promote well-being for all ages. So some contributing factors. So in recent years, Ethiopia has made significant progress in reducing maternal mortality rate with a 50% reduction in maternal deaths. However, challenges and limitations to reducing maternal mortality still exist, including a shortage of skilled healthcare workers in rural areas, inadequate financing of the healthcare system, limited access to emergency care, and cultural practices that hinder women's access to maternal health services. The Ethiopian government has developed several policies and strategies aimed at reducing maternal mortality, including the Health Sector Transformation Plan and also the National Reproductive Health Strategy. These policies prioritize the expansion of maternal health services, improving the quality of care, and increasing the number of skilled birth live attendants. The Health Sector Transformation Plan is Ethiopia's comprehensive health sector development plan that aims to improve the country's healthcare system and services. It also prioritizes maternal and child health as one of its key focus areas, with a specific target of reducing maternal mortality from 420 deaths per 100,000 to 199 deaths per 100,000. In order to achieve these targets, it emphasizes a range of strategies, including improving the quality of maternal and child health services, strengthening health system management and governance, as well as increasing the availability and accessibility of essential medicine and supplies. The National Reproductive Health Strategy of Ethiopia is also a document developed by the Federal Ministry of Health, and it provides a strategic framework for the improvement of reproductive health services in this country. The strategy was developed in response to the high rates of maternal and neonatal mortality, as well as the need to address other reproductive health issues. The strategy aims to improve the quality and coverage of reproductive health services by strengthening healthcare systems, building the capacity of the healthcare workers, as well as increasing access to reproductive health services. In order to address challenges, the Ethiopian government has also implemented several initiatives, including the Health Extension Program, which has trained more than 38,000 healthcare workers, as well as provide maternal and child healthcare services in rural areas. Additionally, the government has launched the Maternal and Newborn Health Quality of Care Act initiative, which aims to improve the quality of maternal and newborn healthcare services through the introduction of evidence-based interventions. So, some future steps that are needed. While progress has been made in reducing maternal mortality in Ethiopia, more attention and resources are needed to sustain and accelerate the progress. The government needs to prioritize increasing the number of skilled healthcare workers, improving the quality of maternal healthcare services, and also expanding access to emergency care. Additionally, efforts should be made to address cultural practices and norms that may hinder women's access to maternal health care services, including early marriage and also female genital mutilation. A multi-sectoral approach that involves the government, civil society, and private sector is needed in order to address the underlying causes of maternal mortality and ensure that all women have access to quality maternal health care services. Maternal health in Ethiopia still remains a critical public health challenge that requires urgent attention. Maternal mortality remains unacceptably high, with an estimated 401 deaths per 100,000 live births. This high rate of maternal mortality is primarily due to preventable causes, such as lack of access to skilled care during delivery, poor quality of care, and delays in seeking medical help. Furthermore, maternal health is closely linked to the health and survival of children, as maternal mortality is the leading cause of infant and child mortality in Ethiopia. The country has one of the highest rates of under 5 mortality in the country, with an estimated 55 deaths per 1,000 live births. Reducing maternal mortality can and therefore have a significant impact on child health and survival in Ethiopia. Investing in maternal health in Ethiopia has the potential to save lives, reduce child mortality, and promote gender equity. It is therefore crucial to continue prioritizing maternal health and to ensure that resources are allocated to address the remaining challenges.